You don't want that. Okay.
Yeah, there's a portion of our society that doesn't have Obamacare for some reason or the other. I don't know.
Yeah.
I see what you're saying.
There's going to be a gap.
Yeah.
Yeah.
But that's a good thing, though, for New Yorkers.
Yeah. And we have a petition to support the bill. We're going to be going up to...
Do you have to be a New Yorker? Because I'm not from New York. I'm just...
Oh,
yeah.
Okay. Yeah.
Can I send you a petition?
Yeah, sure.
So it's going to be free, you're saying, right?
Yeah, instead of paying corporations premiums and deductibles, it would come out of our taxes.
Oh.
And so it would cost less through taxes than it would through premiums than we're paying now.
But how would it cost less? I mean, that's something that kind of baffles me, and I'll explain why. I mean, in my mind, and for full disclosure, I came from USSR originally. Okay, so I saw the system where prices would never go down. In fact, scarcity was the rule of the day. There's nothing really that you could get over there. Healthcare was free. It was free and it was universal.
Right.
It cost you nothing.
Right.
Well, guess what? You couldn't get any care.
Where?
You couldn't get any care.
Where was
in USSR? I'll give you an example. Yeah, USSR. Yeah, the country that doesn't exist anymore.
Thank you so much.
There's a totally different system, I guess.
No, but I'm talking about free. You know, it was free. Allegedly, yeah, free. Everybody can see a doctor.
But look in Canada, it's free also. Universal healthcare, and it's working there.
Do you know that no less than a Canadian Prime Minister flew to Florida to get operated on? I mean, think about it. A Canadian Prime Minister was operated in Florida, not in Canada, in Florida. I wonder why.
Well, there's a lot of reasons for that. Maybe there's a specialist there that specializes.
Why can Canada have a specialist? I mean, it's not a country of 1,000 people or 2,000 people. It's a country of almost 20 million.
Well, the American medical, you know, it's a little bit more advanced than other countries.
Why?
Because of the research and development.
But who invests in research and development? That's the key thing. I mean, who spends money on that? Think about it.
Well, something is it may be a matter of free enterprise that causes it, but
free enterprise that makes our system better than Canadian, right?
Well, but when you talk about ensuring the masses.
Yes.
With, more people are covered.
Yes.
With the insurance than, if you know what I'm saying. I don't think because of that it shouldn't be universal. It should be all Americans should get insurance.
You were young at some point, right?
Yeah.
So was I.
Right.
When you're young, you think that they're kind of invincible. You can live forever. You know, as you grow older, you start realizing, well, unfortunately, we only have so much time on this planet Earth. But we're invincibles, and that's what they're called. So when they're really young, you think, you know what, why should I spend even $100 for insurance? I mean, I'm young, I am healthy. Right. If I have to see a doctor, I'll pay out of pocket, but it's very, very unlikely that I'll see a doctor for the foreseeable future. So don't you think that when we talk about uninsured people, those people, and they're counted, many of those so-called uninsured people are actually those who don't want to get insurance. I mean, did you think about it this way?
I'm not so sure about that.
But you agree with my point. Not most of the people, but a good chunk of them.
Some people don't want to get insurance. But
so
remember,
right there.
Prevention is much better than waiting until you're 65.
But
there's a health care at an early age, education.
But it has nothing to do with universal health care. I mean, it's not helping.
Oh, yeah.
No, it doesn't.
Oh, yeah.
No, it doesn't.
Education.
And if you don't want to see the doctor, why should I care? There's so many people, I'm sure that probably you went through this. I definitely went through that. You make like New Year's resolution. Okay, now I'm gonna get membership in the gym. I'm gonna go there on a regular basis.
I know now it's more important because now I'm married and I have kids and I see the...
Do you go to gym on a regular basis?
Yeah, I do.
You do?
I do.
Have you always been going to a gym on a regular basis?
Yes, I do. But that doesn't mean everybody else does that.
Well, okay, so you're
if you know what I'm saying. Let's say, for example, you're a young guy and you have some type of ailment or sickness. Early prevention can cost so much more cheaper then
on the one hand, yeah, but on the other hand, when you think about the diseases, and I had one, for example, I used to have ulcerative colitis. Nothing would have helped me. Nothing. It was in my genes, and at the age of I was 32, I think. All of a sudden, it popped out. No matter what I did in my life, it wouldn't have helped me. Nothing. So, my point is that, yeah, prevention is a great thing, but what it boils down to is having the insurance. Now, to have an insurance, there are two versions. Universal health care, or, the system that we used to have before Obamacare,
right.
free enterprise. So which one do you think works better?
Anyone you use, there are going to be drawbacks. There are going to be drawbacks and deficiencies.
Nothing's perfect. Which one is better?
Universal health care.
Is better.
Yeah.
And how is it proven that it's better? Where? In Great Britain, I have friends over there. They say it sucks.
In Europe.
In Canada, they say it sucks. For example, I have a friend who lives in Italy, okay, and she came to visit me, recently. And it was her first visit to the United States, and she knows nothing. Really nothing about this country in terms of how it works in this country. And when we talked about the doctor, there are two types of doctors. The doctors that you pay out of pocket, and the doctors who, so-called free health care. And all she has to see is an eye specialist, not like really, really major like brain surgeon, eye specialist. If she were to use her free health care, she would have to wait, guess how long?
6 months?
If not longer.
Yeah, I do believe you.
You go to see a doctor and pay out of pocket, you can see this doctor like right away or within weeks.
There's 40 million people who's not able to do that.
To do what?
That take your money out of your pocket and go see a doctor. There's
But
40 million because of that.
Yeah, but you don't have to. You have the system that was working. It wasn't perfect at all. Was I for changing it? Absolutely. But I would have changed it in a completely different way. Just like you said, free enterprise. What's the basis of free enterprise? Fundamental basis of free enterprise.
The commercialism, the money behind it.
Competition. Agree?
Right.
Competition. Look at car insurance. This is the best example. It's the same insurance. You just insure different things. Instead of insuring health, you insure the vehicle, right? So you can get the car insurance from all over the country. And there is fierce competition on television. Every time you see Geico, you would see Allstate, you will see Progressive, and so on, right? Do you see this kind of advertisement from health insurance?
Well, it's a new thing for our American system.
No. You know why?
It's new for our...
It's not new. Healthcare has been...
No. As far as universal healthcare, it's new for us.
But it eliminates competition, no? Universal, by definition, is going to eliminate competition.
We don't know that yet.
But
there are so much changes that you could make. Once the Republicans and the Democrats come together, that is here to stay, and they're gonna, make changes to it. The one-payer system and stuff like that. But you mentioned about your friend in Europe. I had a friend also who had a brain tumor in England. And they had to send him to the United States.
See, you just brought my point.
But I still believe it's universal health care. I still believe that universal health care is better than...
But how is it better? Look, let's just be honest. The Prime Minister of Canada has to go to Florida. Your friend in Great Britain has to come to the United States.
And do you believe that the reason for that is because they have universal health care?
Yes, I'll explain why. See, the reason the car insurance works, and guess what? The prices are going down, right? It's a very competitive market. The only thing that brings prices down, just one thing, as I mentioned before. What was it? Competition, exactly. But guess what? Can you buy, if you live in New York City, you said you live in New Jersey, right?
Right. Mm-hmm.
So can you buy New York, you just spoke with this guy, can you buy New York insurance?
I don't know.
No, the answer is no.
So they're just going to change it.
It's not going to change.
Interstate insurance. I think they mentioned that. Interstate insurance.
No.
Yeah. You can buy it all over the place.
Yeah.
Anyway, I got to go. Nice talking to you.
Okay, pleasure. Okay, stay healthy.
Okay. I wish you luck, okay? Thank you.